What if the first sign was not forgetting a name? What if it was not losing your keys? What if it was not walking into a room and wondering why you came there? What if the first warning was sitting quietly in your medicine cabinet? Every day, millions of seniors take pills they trust. One pill for sleep, one pill for pain, one pill for allergies, one for the bladder, one for blood pressure, one for anxiety. And after a while, something changes. They feel foggy in the morning. They repeat the same question twice. They become sleepy during the day. They lose balance. They feel confused after taking a new medication. Their family starts whispering the word no one wants to say, dementia. But before you assume the brain is permanently declining, there is one question many people forget to ask. Could a medication be part of the problem? Now listen carefully. This does not mean every medication is dangerous. It does not mean you should stop taking your pills. And it does not mean a medicine is the only cause of memory problems. But after 60, some common medications can affect alertness, memory, balance, and confusion more strongly than people realize. And the scary part is this: these changes are often mistaken for aging. They are explained away as just getting older. They are ignored until the confusion becomes worse. In this video, you will learn 9 common medication groups seniors should ask their doctor about before it is too late. Do not miss number 4, because many people take it at night and blame the next morning on poor sleep. And number 9 may be the one your doctor does not even know you are taking. I'm Dr. Michael Carter, and before we go further, I want to make something very clear. This is not a video telling you to throw away your pills. Medications can save lives. They can lower dangerous blood pressure. They can calm severe anxiety. They can control pain. They can help sleep. They can protect the heart. They can help people live longer and more comfortably. But a medicine that helped you at one point in life should still be reviewed as your body changes. Because after 60, the same dose may not always affect the body the same way. Your kidneys may clear medicine more slowly. Your liver may process it differently. Your balance may become more sensitive. Your sleep may become lighter. And your brain may react more strongly to certain side effects. That is why this video is not about fear. It is about asking better questions. If you or someone you love has new memory problems, sudden confusion, daytime sleepiness, dizziness, or a personality change, do not simply blame age. Bring a full medication list to your doctor or pharmacist. Ask what is still necessary. Ask what may be affecting memory. Ask what should be changed safely. But never stop a prescribed medication on your own. Here is why this matters so much after 60. The older body is not the same body it was at 35 or 45. A medication that once felt mild may suddenly feel stronger. A dose that once caused no problem may now leave someone sleepy, dizzy, or mentally slow. This can happen because the body changes with age. The kidneys may not clear medicine as quickly. The liver may process certain drugs more slowly. The brain may become more sensitive to medications that cause sedation. Blood pressure may drop more easily. Dehydration may happen faster. And sleep may become lighter, which means one nighttime pill can affect the next morning more than expected. But there is another problem. Many seniors are not taking just one medication. They may be taking 5, 6, 7, or even more. One pill may cause drowsiness. Another may lower blood pressure. Another may dry the body out. Another may affect sleep. And when these effects stack together, the result can look like memory decline. A person may feel foggy. They may lose balance. They may struggle to find words. They may seem confused in the afternoon. And everyone around them may assume the worst. But before calling it dementia, ask this question. Did anything change in the medicine list? A new pill? A higher dose? A new sleep aid? A new pain medicine? A new over-the-counter product? Because timing can be the clue. And the first group many seniors should ask about is one they often take at night. The first medication group seniors should ask about is sleep aids. This is one of the most common places where memory problems can become confusing because the person is not taking the pill during the day. They are taking it at night. They think the effect should be finished by morning. But for many older adults, that is not always what happens. A sleep aid may help someone fall asleep, but it may also leave the brain heavy the next day. The person may wake up feeling slow. They may feel unsteady when they walk to the bathroom. They may forget conversations from the night before. They may feel dull, sleepy, or disconnected in the morning. And when this happens again and again, family members may begin to worry. They may think, is this dementia starting? But the real clue may be timing. Did the confusion begin after a sleep pill was started? Did it get worse after the dose was increased? Does the person seem foggier in the morning than later in the day? Does the memory problem appear after nights when the pill was used? These questions matter. Sleep is important. Poor sleep can damage mood, focus, blood pressure, and memory. But simply sedating the brain is not always the safest long-term answer for seniors. So do not stop anything suddenly. Instead, ask the doctor, is this sleep medicine still safe for my age? Could it be affecting my memory or balance? Is there a safer way to improve sleep? Because the pill taken at night may be the reason the brain feels cloudy the next morning. And the next group is even easier to overlook because many people buy it without a prescription. The second medication group seniors should ask about is allergy medicine. This one surprises many people because allergy pills feel ordinary. They sit in bathroom cabinets. They are bought at the store. They are taken for sneezing, itching, runny nose, watery eyes, or a cold that will not calm down. So people assume they are harmless. But over-the-counter does not always mean risk-free. Some allergy medicines can make older adults sleepy, slower, dry, dizzy, or mentally foggy, and that fog can be mistaken for aging. A senior may take an allergy pill at night and wake up confused, or they may take one during the day and feel unusually tired. They may become forgetful. They may seem less alert. They may have dry mouth, constipation, blurry vision, or trouble urinating. And if they are also taking a sleep aid, pain medicine, or anxiety medicine, the sedating effect can become stronger. That is where the danger begins. Not always from one pill alone, but from the combination. One medicine makes the brain sleepy, another slows reaction time, another affects balance, and suddenly the person looks like they are declining. But the real problem may be hidden in the medicine cabinet. So before using allergy medicine again and again, ask your doctor or pharmacist, is this safe for my age? Could this affect memory or balance? Is there a non-drowsy option? Could this interact with my other medications? Because common does not always mean harmless. And the next group is even more serious because it can calm anxiety while quietly slowing the brain. The third medication group seniors should ask about is anti-anxiety medicine. Now this is very important. Anxiety is real, panic is real, restlessness, fear, racing thoughts, and constant worry can destroy sleep, appetite, blood pressure, and quality of life. So this is not about judging anyone who needs help. But some medicines that calm the nervous system can also slow it down. And in older adults, that slowing may show up as confusion, forgetfulness, daytime sleepiness, poor balance, or slower reaction time. A person may seem less sharp. They may answer slowly. They may lose interest in normal conversations. They may appear emotionally flat. They may forget what happened earlier in the day. And family members may think something is happening to their brain. But the question is, did this start after an anxiety medicine was added? Did it happen after the dose changed? Did it become worse when the medicine was combined with a sleep aid or pain pill? That combination matters because one medicine may calm the mind, another may make the body sleepy, another may affect balance, and together they can make a senior look much older than they really are. A calmer body should not come at the cost of a foggier brain, but do not stop anti-anxiety medicine suddenly. Stopping some of these medicines too quickly can be dangerous. Instead, ask the doctor, is this still the right dose for me? Could it be affecting my memory? Is it safe with my other medicines? Is there a safer long-term plan? Because sometimes the goal is not to remove the medicine. The goal is to make sure the medicine is not silently removing clarity. And the next group is one many seniors take because pain has become part of daily life. The fourth medication group seniors should ask about is pain medication. And this one matters because pain is not a small thing. Pain can steal sleep. Pain can reduce movement. Pain can make someone depressed, tired, and irritable. Pain can keep a person trapped in a chair when they should be walking, stretching, or living. So the message is not ignore pain. The message is treat pain carefully, because some pain medicines can affect the brain, especially in older adults. They may cause sleepiness. They may slow thinking. They may make balance worse. They may cause confusion, especially after a new dose, a stronger pill, or a combination with other sedating medicines. A senior may take something for back pain, arthritis pain, nerve pain, or surgery pain. Then the family notices something strange. They are harder to wake up. They repeat themselves. They seem disconnected. They stumble more often. They forget what they were doing. And suddenly, everyone fears dementia. But before assuming the worst, look at the timeline. Did the fog begin after pain medication started? Did it get worse after the dose changed? Is it stronger at certain times of the day? Is the person also taking a sleep aid, allergy pill, or anti-anxiety medicine? Because pain medication plus other sedating medicines can create a powerful effect. Pain can steal your life. But the wrong dose at the wrong time with the wrong combination can steal your clarity. So ask the doctor, is this pain medicine affecting memory or balance? Can the dose be adjusted safely? Are there safer options for long-term pain? Could physical therapy, topical treatments, or another plan reduce the need for stronger medicine? Never change pain medicine suddenly without medical guidance. But do not ignore confusion after a medication change. And the next group is one many seniors take for a private problem they may feel embarrassed to discuss. The fifth medication group seniors should ask about is bladder control medicine. And this one is very common after 60. Many people deal with frequent urination, urgency, nighttime bathroom trips, leakage, embarrassment, fear of leaving the house, fear of not making it to the bathroom in time. So when a medication helps calm the bladder, it can feel like freedom. It can help someone sleep better. It can help them travel again. It can help them feel less anxious in public. But here is the part many people do not realize. Some bladder medicines can affect more than the bladder. In some older adults, they may also cause dry mouth, constipation, blurry vision, dizziness, or mental fog. And sometimes that mental fog is mistaken for dementia. The person may seem more forgetful. They may feel slower. They may become confused after starting the medicine. They may not connect it to the bladder pill because the symptom feels like a brain problem, not a bladder problem. But timing matters. Did the memory change begin after the new bladder medication? Did confusion become worse after the dose increased? Did dry mouth, constipation, or dizziness appear at the same time? These clues are important. A medicine that calms the bladder should not quietly cloud the brain. So ask the doctor, could this bladder medicine affect memory? Is this the safest option for my age? Is there a lower dose or different treatment? Could my nighttime bathroom trips be caused by something else? Never stop it on your own, but never ignore sudden confusion after starting it. And the next group is taken by millions for heartburn, reflux, and stomach discomfort. The sixth medication group seniors should ask about is acid reflux and stomach medicine. These are medicines people take for heartburn, indigestion, reflux, stomach burning, or sour taste in the throat. And for many people, they can be very helpful. When stomach acid is causing pain, poor sleep, coughing, or trouble eating, the right treatment can make life much better. But the problem begins when a medicine that was meant for a short period quietly becomes a long-term habit. A person starts taking it after a bad stomach flare. Then 1 month becomes 6 months. 6 months becomes 3 years. And no one ever asks the question, do I still need this? Now, this does not mean these medicines cause dementia. That is not the point. The point is that any medicine taken for months or years should be reviewed, especially after 60. Because the older body changes. Nutrition changes. Absorption changes. Other medications are added, and what once made sense may need a second look. Some seniors keep taking stomach medicine because they are afraid the symptoms will return. Others take it because it is already part of the routine. Morning coffee, breakfast, blood pressure pill, stomach pill, and they never question it again. But if there is new weakness, fatigue, fogginess, poor appetite, or unexplained changes, the medicine list should be part of the conversation. Ask the doctor, do I still need this every day? Is this the right dose? Should this be short-term or long-term? Could it affect anything else I'm taking? The question is not, is this medicine bad? The question is it still right for me now? And the next group is seniors should never stop suddenly because it affects both mood and the brain. The 7th medication group seniors should ask about is depression medication. And this section must be handled carefully because depression is not weakness. Depression is not laziness. Depression is not something a person can always snap out of. For many seniors, depression can appear after grief, loneliness, illness, retirement, chronic pain, poor sleep, or losing independence. And sometimes depression itself can look like dementia. A person may stop concentrating. They may forget appointments. They may lose interest in family. They may sit quietly for hours. They may seem slower, less motivated, or emotionally distant. So treating depression can sometimes help the brain feel clearer. But here is where the medication review matters. Some people may feel sleepy, foggy, emotionally flat, dizzy, or mentally slower after a dose change, or when depression medicine is combined with other medications. That does not mean the medicine is bad. It means the dose, timing, combination, or treatment plan may need review. This is why guessing is dangerous. If memory problems begin after starting a mood medication, write down the timing. If confusion becomes worse after a dose increase, write it down. If the person also takes sleep aids, pain pills, anxiety medicine, or allergy medicine, tell the doctor. Never stop depression medication suddenly. Stopping too quickly can make symptoms worse and may cause serious withdrawal-like effects. Instead, ask, could this dose be affecting my focus? Is this safe with my other medicines? Should we adjust the timing? Is depression itself causing my memory problems? Because sometimes the brain is not failing. Sometimes the treatment plan needs a second look, and the next group protects the heart, but still needs careful monitoring. The 8th medication group seniors should ask about is blood pressure and heart medicine. Now listen closely. These medicines can be extremely important. They may help protect the heart. They may reduce stroke risk. They may control dangerous blood pressure. They may help manage heart rhythm. They may keep someone alive and stable. So this is not a warning to stop them. It is a warning to monitor them carefully. Because sometimes, when blood pressure drops too low or the heart rate becomes too slow, a senior may not simply feel tired. They may feel foggy. They may feel weak. They may feel dizzy when standing. They may feel sleepy during the day. They may struggle to focus. They may even seem confused. And family members may think the brain is declining. But the real issue may be that the body is not getting the right balance. Too high blood pressure can be dangerous, but too low can also create problems. This is especially important after a dose change, a new pill, a stronger dose, a second medication added, or a period of dehydration, poor eating, illness, or weight loss. That is why symptoms matter. If someone becomes dizzy after standing, feels faint, becomes unusually tired, or seems mentally slower after a blood pressure change, write it down. Check home blood pressure if the doctor recommends it. Track the time of day symptoms happen, and ask, could my blood pressure be going too low? Is my heart rate too slow? Are these medicines still the right dose? Should I bring home readings to my next visit? A medicine protecting your brain from stroke should still be watched carefully. And the final group may be the most overlooked because many people do not even think of it as medicine. The 9th medication group seniors should ask about is over-the-counter pills, supplements, and mixed medicine cabinets. And this may be the most overlooked group of all, because many people do not count these as medicine. They say, oh, it is just a cold pill. It is just a nighttime formula. It is just a vitamin. It is just an herbal supplement. It is just something I bought at the store. But if it affects your body, your doctor needs to know about it. Some over-the-counter products can cause sleepiness, dizziness, dry mouth, constipation, blurry vision, or confusion in older adults. Some nighttime cold and flu formulas may contain ingredients that make the brain feel heavy the next day. Some supplements may interact with blood pressure medicine, diabetes medicine, heart medicine, blood thinners, or sleep medicine, and sometimes seniors accidentally take duplicate ingredients without realizing it. One pill for sleep, one pill for allergies, one cold medicine at night, one pain reliever in the morning, one supplement recommended by a friend, and suddenly the brain feels foggy, the body feels weak, and everyone blames age. But the doctor cannot protect you from something they do not know you are taking. So before your next appointment, do this. Gather everything: prescription bottles, store-bought pills, vitamins, herbal supplements, sleep products, cold medicine, pain relievers, creams, drops, patches, and powders. Put them in one bag or write them in one list. Then ask, could any of these affect my memory, balance, or alertness? Could any of these interact with each other? Am I taking the same ingredient twice? The most dangerous medicine may be the one your doctor does not even know about. And now, here is the checklist every senior should use before the next appointment. Now here is the medication checklist every senior should use before the next doctor appointment. Do not walk into the appointment and simply say, "My memory is getting worse." That is important, but it is not enough. You need details, because the timing of symptoms can be the clue. Start by writing down every medication you take, not just prescriptions, everything: sleep aids, allergy pills, pain relievers, bladder medicine, stomach medicine, mood medicine, blood pressure pills, heart medicine, cold medicine, vitamins, herbal supplements, anything you take at night, anything you take only sometimes, anything someone else suggested. Then write down when the memory problem started. Was it sudden? Was it after a new pill? Was it after a higher dose? Was it worse in the morning? Was it worse after meals? Was it worse at night? Was it connected to dizziness, sleepiness, falls, constipation, dry mouth, or blurry vision? These details help the doctor see patterns. Then ask these questions. Could any of my medicines affect memory? Could any of them affect balance or alertness? Do I still need every medication on this list? Are any of these interacting with each other? Am I taking two products that do the same thing? Can any dose be lowered safely? Is there a safer option for my age? And one more question is very important. Could this be medication-related, or do I need testing for dementia? Because you do not want to guess. You want answers. One honest medication review can reveal problems that families may miss for months. But there is one mistake that can make everything worse. The biggest mistake seniors make is stopping medicine suddenly out of fear. Please do not do that. Fear can make people panic. They hear that a medication may affect memory, and they think the safest thing is to stop it immediately. But that can be dangerous. Some medicines should never be stopped suddenly. Blood pressure medicine, heart medicine, diabetes medicine, anxiety medicine, depression medicine, seizure medicine, strong pain medicine, sleep medicine. Some of these may need to be reduced slowly. Some may need a replacement. Some may be protecting you from a much bigger problem. So the message is not quit your medication. The message is review your medication. There is a big difference. Do not let fear make the decision. Let information guide the conversation. If you are worried, call your doctor or pharmacist. Ask for a medication review. Bring your bottles. Bring your list. Bring your symptoms. And if you are a caregiver, do not accuse the person. Help them organize. Help them track the timing. Help them ask safer questions. Because the goal is not fewer pills at any cost. The goal is the right medicine, at the right dose, for the right reason, with the clearest mind possible. Now here is what you should remember.